We know that CD19 CAR T-cell therapies have transformed the landscape in terms of treatment for patients with relapsed refractory large B-cell lymphoma. But despite that, most of the patients don't achieve long-term remission. That's because a lot of these patients can have relapses, and one of the major problems with relapse is antigen loss or antigen escape by the tumour cells. So the whole idea of this product, JNJ-90014496, is that it's a bispecific CAR T. So it's targeting not one antigen, but two antigens on the malignant B cells, so CD19, CD20, rather than just CD19. And the whole idea is that if you have a dual targeting strategy, you may be able to prevent antigen escape after CD19 CAR T-cell therapy in patients with large B-cell lymphoma. So the structure is that you've got a CD19 antibody, FMC63, CD20, which is again, single chain, a variable fragment that targets two regions within the CD20 region, and the co-stim domain is a 4-1BB domain. And this product has been shown to be quite effective in an earlier Chinese study with a CR rate of 86% and around 50% with durable CR, with a good PFS and OS after 4 years of follow-up as well. So the phase 1B global study is really a concurrent study that is looking at a wider population of patients globally, rather than just the Chinese population. And we've had 51 patients, 3 dosage groups. So patients that were adults with relapsed refractory large B-cell lymphoma, CD19 and or CD20 expression, 2 or more prior lines of therapy, and 1 prior line of therapy if they're older and not transplant eligible. They then can be enrolled onto the study. These patients are then apheresed, so their T cells get harvested and get manufactured. And bridging therapy is allowed for these patients at the discretion of the investigators. And then the patients were then dosed according to 1 of 3 dosage groups. So the first one is a weight-based, 2 million cells per kilogram dosage group. The second is a fixed 150 million cell group. And the third is a 75 million dosage group. And the 75 million dosage group, the 75 million CAR T cells was found to be the most safe and well tolerated and efficacious. So that was chosen as the recommended phase 2 dose. And then so we've had really some promising results in terms of efficacy and safety. So in terms of safety, we've seen only 1 case of grade 3 CRS. In the recommended phase 2 dose group of 75 million CAR T cells, we didn't see any grade 3 or 4 CRS events. Most was grade 1. And with regards to ICANS, in the recommended phase 2 dose group, we've had just 1 grade 3 ICANS, and that was in a patient that had CNS lymphoma, was found to have CNS lymphoma after study entry. And then another one was a grade 1 in a patient that had hydrocephalus. But otherwise, very well tolerated, very low infection rate, or grade 3 or 4 infection rate as well. So only 3 cases in the 51 patients, and only 1 case in the recommended phase 2 dose group as well. So, and the efficacy is quite promising. So in the recommended phase 2 dose group, if the patients only had 1 prior line of therapy, the CR rate's 80%, the overall response rate's 100%. In those that had 2 or more prior lines, the CR rate's 75%. So irrespective of how many lines the patient has had before, patients achieved a really good response with the 75 million CAR T cell dose. So yeah, let's hope this good result will continue on, and obviously more investigations needed and with a longer follow-up. And so there will be new cohorts opening up in recruiting patients, for example, high-risk frontline patients that haven't done as well with frontline therapy. Obviously, we're also recruiting patients that have had prior CAR Ts. So all the patients that were presented at this conference, they were CAR T naive. But in the future, we'll have a CAR T exposed group as well. And we'll be enrolling patients to see whether we can salvage these CAR T failed patients with this bispecific CAR T product.